Good evening, ladies and gentlemen. I hope you can all hear me very clearly. My name is Paul Wilson, Executive Director of Planning, Business Development and International Relations at Index Holding. Welcome to this evening's webinar brought to you by Waterfalls Education in collaboration between Hamdan bin Mohammed Smart University, HBMSU, and Index Conferences and Exhibitions. We are delighted to introduce today's speaker, Dr. Mansoor Awar, Chancellor of HBMSU, Chair of UNESCO Governing Board, Institute for the Information Technologies in Education. Dr. Mansoor started, built and led several innovative enterprises. He founded Hamdan bin Mohammed Smart University, the region's first university with smart learning approach. He established the first quality department at Dubai Police, in addition to his major roles in building the Middle East E-Learning Association, MEEA, and the Middle East Quality Association, MEQA. Dr. Mansoor served as a chair for several awards related to innovation leadership, education, and excellence. For example, he served as a chair of jury for the Minister of Interior Excellence Award for 5 consecutive years in the United Arab Emirates, a chair of jury for the Egyptian Government Excellence Award in 2019, and a judge for the Innovators Under 35 Awards, IU 35, by MIT Technology Review, Arabia. And for today's topic, the webinar is Quality versus Crisis. You will have a chance to ask questions throughout the session using the Q&A tab at the bottom of your screen, and we shall select some of the questions for Dr. Mansoor to answer at the end of his presentation. So without further ado, it gives me great pleasure to welcome Dr. Mansoor to this webinar, and I hand over now to Dr. Thank you very much.
Thank you, Paul, and welcome on board, dear participants in this webinar. It's given me a great pleasure to be coming with you here for the presentation, and I hope that tonight we will be sharing some thoughts about the quality and the crisis currently is happening around us, and everybody seems to be on this globe being affected in a way or another. My talk is not going to be a little bit different from other colleagues because I'm not a physician, neither I belong to the healthcare sector, but rather than an academician, an applied mathematician who did his research and thesis in optic nerves. So in a way or another, I'm a little bit close to physiology, and if it is right to say so. However, my talk is not going to be touching that area at all, but my talk is going to be on a very holistic approach in terms of the quality management and excellence versus crisis, which is at hand at the current moment. And I'm going to talk about kind of experience being built of how we're going to be able to compare, how we're going to be able to establish kind of terms of reference in terms of how we manage, how we control, how we do deal with the crisis. So in order not just to make it long for you for as a start, I'm going to start my presentation right away. And the first slide I would like just to share is my mentor, the person who I've been taught from, His Highness Sheikh Mohammed bin Rashid Al Maktoum, the Vice President of the United Arab Emirates, the Prime Minister and the ruler of Dubai. In his early book entitled My Vision, the challenges in the race of excellence, for excellence, I think it's this quote has been from that book in the page 69. He says, making the right decision at the right moment is the most important factors for success. And he continues by saying, making such decisions is also one of the most important responsibilities of true leaders, because it calls for daring, willpower, a quick response, and a deep awareness of the consequences of the decision and how they will fit into the leader's goal. it's all about decision making, ladies and gentlemen, tonight with my speech, with my webinar. I'm going to share it with you currently. And the thing that I'm going to share with you as well is a quote from Albert Einstein. He says that in the midst of every crisis lies great opportunities. However, this great opportunity will lie ahead of us only if we adopt the principles and the essence of the quality management. This is my interpretation to his quote. So if the quality management is not there, so that the opportunities will lessen in terms of grabbing it and move forward into our lives. So I will start with the first part. I have two parts in my speech. One is the essence of quality. I talk about the essence because I feel that tonight I'm going to talk about the soul of quality management. I'm not going to go by book, although going by book by principles of quality management is essential, but it will be as much essential as the first part by the book. So the essence of quality management, in order to bring the quality to any entity, ladies and gentlemen, we have to have four elements of four values of the quality. We have four elements and four values. Elements represent the tangible part. The elements of quality is something that we do by book, is the tangible ones. And the values represents the intangible part. And that's what matters the most today's speech. So the quality, in my view, cannot exist unless we have both parts together. The way that I give a metaphor for this particular approach is if you provide me by your CV actually describes you very well. It's structured and it's highlighted. Wow, I would be mesmerized by your CV. However, the CV is not always enough because that is the tangible part. But what matters most is the part of the face-to-face interaction when you go for the interview, because that is where the intangible things will be going to come across the interviewers as well. So those two parts are essential, whether it is face-to-face in an interview and your CV, and the same happens to the elements of quality and the values of quality. So it has to come both together. Now, in terms of the elements of quality, represent the tangible part, as I have said, and the intangible part. However, the first element, it cannot exist. The first element into the tangible part is leadership, ladies and gentlemen. Why? Why? Because leader has the authority to change the present situation. If the leader is not committed to quality, there will be no quality to be achieved. The only thing the quality management is all about, that it comes from the top. The quality management in any entity around the world cannot be built bottom up. It has to be top down. And that is where the leadership is a crucial, essential element of quality management. The second element is a comprehensive survey. This element is, ladies and gentlemen, of a vital importance, as it determines where the positive and negative aspects are, where and how to start bringing quality to the organization. Because that will be the part of the self-assessment, and that is where the comprehensive survey should take place. if we would like to start, where to start, what's the point of a start, I have to know which ground I'm standing on. Of course, that particular survey should include equipment, utilities, buildings, and the opinion of the stakeholders across the board. The third element of tangible part of the quality management, I know, ladies and gentlemen, it might get you a little bit boring, but please bear with me, because I'm trying to establish terms of reference when we're going to be able to talk about the crisis. I'm talking about quality versus crisis. So I need to establish terms of reference for you all. So the third element of quality, which is tangible again, is a part of plan of action. Once I have a good leadership and I did my comprehensive survey, now I need to plan. I need to have a plan of action. And this element, actually, what it means, plan of action, this element is to establish culture of quality. Quality without planning is not quality. So the establishing of a culture is very important to have an action plan. And this element also is to establish total quality from all perspectives: services, customers, staff, employees, from a complete cycle of people who are within the organization. This element also, ladies and gentlemen, means and to establish integrated policies, horizontal and vertical, and stable programs. So establishing, those are actually the plan of action. You will be having the culture, you will be having the total quality, the three pillars of quality: the service itself, the recipient, and the providers, service providers, and also the policies. And this element also, action of plan, actually means to review organizing regulations, because we might have certain regulations which had become obsolete. So we need to be able to review at all times. Regulations which were very effective in the year 2000, not necessarily will be the same to be applied by 2020. This plan of action means also, ladies and gentlemen, that to ensure continuous improvement. And that's the essence of quality. That is the tangible element. If you don't feel it, you don't touch it. That's why, ladies and gentlemen, always been said by quality is a conviction by your mind, is a conviction by your mind. It's a passion within your heart. It's a tangible thing that you will feel it by your own hands. That's the three pillars actually of quality, and the three fundamental things of quality management. So it's also action of plan means emphasis community service. No matter which entity we are belonging to, at the end, we are serving our community. That is the action plan. It does not mean that I am perfect inside the organization unless some measurable indicators will prove that you are serving. The emphasis is on community service. The outcomes should be, the key performance indicator should be how much you are serving the community. Whether you are in education sector, whether you're in a healthcare sector, whether you're in economic sector, which sector that you are talking about, which entity that you belong to. And the last, not the least part of the tangible part of quality is documentation, follow-up, evaluation, continuous evaluation. And by this, the plan of action, ladies and gentlemen, should be documented, including all changes for comparison, control, and accountability. If there is no documentation, we will be very vulnerable not to be able to have the continuous improvement approach. And it also means, the documentation, follow-up, and evaluation, that the follow-up is very important in order to be sure of the complete commitment to the plan. So it's not just only documentation, but also the follow-up. It might look sometimes in documentation, things are very fancy, but because there is no follow-up, things will becoming obsolete even in days nowadays. So it also means the documentation, the fourth element, that evaluation is vital so that we may introduce amendments to the plan in case of reapplication. If something similar would happen, so we might be able to we do amendments to reapplication of the same process. So these are the four fundamental elements of quality, which I called it a tangible things. These are the action things, things that most of organization sometimes will be focusing on it, and really they did excel in those terms. However, my interpretation to the quality tonight, ladies and gentlemen, is on the other half of the quality that I talked about. And the other half actually are the values of quality. That's the morale. That is actually what I call the soul of quality. You might be good in elements of quality. However, you might considerably fail when it comes to the values for quality. Let us examine the four values that I'm going to talk about. The first value is credibility. Credibility actually is the state of being deserved to be believed and trusted. It's the state of being deserved and trusted. You're credible. If the leader loses credibility or has credibility gap, the employees will not trust or believe what he says or does in terms of quality. That is where the exemplar, leading by example, is something very essential, because otherwise people will look up to whom to be able to implement quality. The credibility also, ladies and gentlemen, means this state of incredulity will negatively affect the employee's performance. Credible. The fourth meaning of credibility is that the credibility, ladies and gentlemen, necessitates taking the right decision and actions in the timely manner. That was the quote of His Highness Sheikh Mohammed bin Rashid when I introduced tonight. The leader should take the right decision in a timely manner. That differs between the soul of quality and what documentation and what tangible thing that you might claim that you might have. Now, the second part is about integrity. Integrity sometimes is impartial, by ladies and gentlemen, when we talk about Arabic. In Arabic language, sometimes we interpret integrity as a nazaha. So it cannot be impartial. I mean, we define it as an impartial partial word, but it could be a whole word. The integrity is either 100% or 0. There is no 99.9 even into it. So the integrity is the state of being honest and strong about you believe what you believe to be right. That is important. It also indicates that the leadership of any organization looking forward to bringing quality to the organization should be of great moral integrity. That is something very, very essential. That is what I call it. It's intangible, ladies and gentlemen. When you talk about moral integrity, it's something inside us. It's something within us. It's something that we live with. So you cannot have something like tangible, like the elements of the quality, but really it matters a lot. And integrity also means that if not, the leader is a bit of a show off and his employees will not trust him. This will be reflected in the performance immediately. That has been proven by research. And also integrity necessitates taking the right decisions and actions, again, in a timely manner. Ladies and gentlemen, all those values of quality, read my lips if I am right to say so. Every single one at the end, I'm talking about timely manner. Decisions and actions to be taken in timely manner. And the third one, of course, is about accountability. How come the accountability will become kind of values of quality? Isn't it a part of something tangible? Yes, it is tangible when I'm going to be able to hold you responsible for the first part of the 4 parts of your plans, of your outcomes, but actually the accountability here, what I'm trying to say is the state of being responsible for the effects of your decisions and actions, and willing to explain or be criticized for them. So it is first assessment to yourself. You're accountable to yourself, to your subconscious, and as a person. And accountability means also that decisions and actions should be taken again in timely manner. And accountability actually is to make you rethink and reconsider your decisions. That's what I told you. It's inside you. It's something between you and your boss, because that will become very tangible. I'm not talking about that level of accountability. That is available. But do you have that you go back and you rethink your decisions and you reconsider your decisions and actions, not to be held accountable to higher authorities only? So I think that accountability is a major. Now, the 4th component, ladies and gentlemen, is about transparency. Transparency. From the administrative point of view, ladies and gentlemen, transparency is the state of making information, decisions, and actions clear and open. I'm just reminding all of our participants. I'm trying to establish the terms of reference when I talk about quality, because I'm going to talk versus about the second half, which is crisis, after a while. And I just remind you of those type of principles when it comes to quality. So the transparency is the state of making information and decisions and actions clear and open. Transparency, ladies and gentlemen, necessitates taking the right actions and decisions in a timely manner. The 4 values of quality, ladies and gentlemen, which are intangible, or about taking actions and decisions in timely manner. So, in other words, to conclude, the quality thing is absence of any value of those 4, ladies and gentlemen, is the absence of all values. We cannot segregate credibility from integrity. Okay, I have 2 out of 4. It will not work because absence of quality. So the absence of one is the absence of all. The absence of all is the absence of quality. So that's in a nutshell. I will move now. This is what I try to elaborate for absence of any value, absence of all values, and there is no quality. Now, we will come to the second part. And crisis analysis. This is very important also when I do the analysis. What is crisis, ladies and gentlemen? I think most of the participants might know this part, but crisis actually has many definitions. But the one I think most suitable defines crisis as follows. The crisis is in any event that is going to lead to an unstable and dangerous situation affecting an individual group, community, or whole society. There are 2 types. There are types of crisis. There are many types of crisis, ladies and gentlemen. There are economic crises, there are political crises, and there are social crises, and there are ethnic crises as well. But the most dangerous one, ladies and gentlemen, is the health crisis, which are all of us around the globe. We are in it currently, and maybe for the last 2 months or more. Now, health crisis, ladies and gentlemen, is a difficult situation that affects humans in one or more geographic areas from a particular locality to encompass the entire planet. Health crisis also generally has impacts on community health, loss of life, and on the economy. And I think every one of us, as we hear these statements, we just go around and just rewind the movie, which is we are currently actually living. They most result from disease. Its severity is measured, actually, those health crises, by the number of people affected by its geographical extent and the number of deaths. Now, facts on the present situation, ladies and gentlemen, these are facts. One, little is known about the coronavirus. No matter how much the social media and how much the unreliable resources will provide us today through the media channels to all of us around the globe. But still is a little is known. Every day they add a little bits and pieces here and there about the coronavirus and its behavior. The second fact is rapidly spread. The third affects the lung. That was the most obvious things, and I will tell you why in a moment, why it affects the lung, why I put it as a fact, because that is where it started. Fourth is the lack of trustworthy information. That's what I said. The social media, almost 68% of the content of the social media is coming from not a trustworthy channel. Although the majority of viewers of those 68 are the majority on the planet, unfortunately, of information. 5, to date, there are no specific vaccines or medicines being tested and approved worldwide for COVID-19. These are, ladies and gentlemen, the 5 facts for the present situation. Now, I'm going just to be able to say endemic for those who, like myself, who are not in the field of healthcare. Endemic actually is disease affects people in particular place or among particular group of people present in a neighborhood or town. Limited. But pandemic, which is currently the COVID-19 is being described by, is a pandemic disease affects people over a very large area in the whole world. Ladies and gentlemen, the key difference between the two words is about the scale under which. So the coronavirus is a pandemic in terms of the scale under which it affects the whole thing. Now, let me go back to the facts as well. How it has started. And controlling this coronavirus, it started as a matter of fact, this pandemic did not outbreak all of a sudden. Although it is highly infectious and easily and rapidly passes from one person to another through the air we breathe, it did not happen overnight. It did not happen overnight. Let us follow the timeline, ladies and gentlemen, currently. Follow the coronavirus outbreak. Let us follow the timeline. The first one you see, the cluster, is when on 31st of December 2019, when Wuhan Municipal Commission, China, reported a cluster of cases of pneumonia in Wuhan, Hubei province. That was in China. That was on 31st of December 2019. On January 1st, ladies and gentlemen, the WHO, the World Health Organization, Incident Management, which is called the IMST support team, had been set up, putting WHO on an emergency for dealing with outbreak, only a day after Wuhan Municipal announced it. of a case of pneumonia. On the 4th of January, it was reported on social media that there was a cluster of pneumonia cases in Wuhan. Look at the timeline, ladies and gentlemen. I'm very specific and meticulous in terms of having those dates in place because I followed up what has been officially announced during these dates. And on 5th of January 2020, the first disease news on the new virus was published, including all information reported by China about the status of patients and the public health response. That was on 5th of January. On 10th of January, based on what was known about the virus at that time, technical guidance was published online to all countries, ladies and gentlemen, on how to detect, test, and manage potential cases. These are for facts. On January 12th, ladies and gentlemen, China publicly shared the genetic sequence of COVID-19. And on January 13, the first recorded case of COVID-19 outside of China was in Thailand. That was the first, on 13th of January. On 14th of January, in a press briefing, it was published that there may have been limited human-to-human transmission, limited, on the coronavirus, and that there was a risk of possible wider outbreak. On January 2021, the WHO, the World Health Organization, experts to China, issued a statement saying that there was evidence of human-to-human transmission in Wuhan, but more investigation was needed to understand the full extent of transmission. On January 22, 23, the WHO Director General convened the Emergency Committee, EC, to assess whether the outbreak constituted a public health emergency of international concern. The independent member from around the world could not reach a consensus based on the evidence available at that time. That was on 22-23 January 2020. They asked to be reconvened within 10 days after receiving more information. And now here it is. The 30th of January, the WHO Director General reconvened the emergency committee and declared the novel coronavirus outbreak constituted a public health emergency of international concern. At that time, the WHO situation reported indicated 7,818 total confirmed cases, with the majority in China. 82 cases in different countries at that time of 30th of January. On 3rd of February, WHO released the international community's strategic preparedness and response plan in order to help protect states with weaker health systems. In February 11 and 12, 2020, the Research and Innovation Forum was convened at WHO on COVID-19. The forum was attended by more than 400 experts and funders from around the world, including Chinese experts, in order to shed light on the situation. On February 16 to 26 almost, a global mission included experts from WHO, China, Canada, Germany, Japan, Nigeria, Republic of Korea, Russia, Singapore, and United States visited China and issued a report raised the alarm at coronavirus. On March 11th, WHO made the assessment that COVID-19 being characterized as a pandemic. Now, someone might ask, Dr. Mansoor, why you have taken us so long journey to understand those timeline on which the facts has been announced officially by official entities around the world. And on March 13, COVID-19 Solidarity Response Fund was launched to receive donations from private individuals, corporations, and institutions. And on March 18th, WHO and partners launched the Solidarity Trial, an international clinical trial that aims at robust data from around the world to find the most effective treatment for COVID-19. Now, this timeline, this is my analytical view, actually. The timeline shows that China officially reported a cluster of cases, pneumonia, on December 31st. A novel coronavirus was eventually identified. On January 30th, WHO, who gave a risk assessment regarding coronavirus of very high of China and high at the global level, with 7,818 confirmed cases worldwide. This is kind of a point. This means, ladies and gentlemen, that as of January 30th, every single country around the world has become fully aware of the fact that the coronavirus is a very dangerous and highly contagious disease. That is where the conclusion of this thing. Although there are neither medicines nor vaccines against coronavirus, some precautionary measures must have been taken by every government within a maximum 3 to 4 days. That means that by maximum, like 5th of Feb, all governments around the world should have taken that particular step of precautionary measures, since the vaccine, neither vaccine or cure is available for that particular virus. And after January, in order to protect its people against the danger of contagion. Now, the important precautionary measures, medical tests of COVID must be conducted for suspected patients, and confirmed positive must be quarantined. Provision of medical supplies such as face masks, gloves, sanitizers, disinfectants, ventilators. Health officials should have raised awareness actually about COVID-19 among its people from that early moment. Now, it includes also social distancing and all these type of things that I've told you about. The suspension of all inbound and outbound passengers should have been flights and transit of airlines passengers, and lockdown measures must be taken. This should have been taken from the 5th of February. From work from home and online, at home, an inevitable choice, distance learning is a must. Those type of measures should have been taken immediately after that particular outbreak, and when WHO made it very clear that it's becoming kind of a global threat. Now, do you think, ladies and gentlemen, that measures were taken by all countries within the maximum 3 or 4 days after January 30th? I will leave that answer to you all, because everyone around the globe knows when this has been taken seriously. And it might somehow explain the reason of the huge, this pandemic rapidly widen up through these type of taking these matters seriously around the globe. The decisive answer from my side is, of course, is definite no. The great majority of the countries, the answer is definite no. They said that it might be kind of a flu and this and that, and all of a sudden it outbreak considerably, and it crushed also some of the healthcare systems, of the advanced healthcare systems around the world, which every one of us know about it and today. So coronavirus has turned into a pandemic disease because of untaking these type of things seriously. Turned into a pandemic disease in just a few weeks. The decisions and actions were not taken in a timely manner. That timely manner, it goes to my terms of reference of when I talk about the quality. If those measures would have been taken in a timely manner, not to become it was too late, it would have changed the total direction of what we are trying to do today. And conclusion, of course, of this, that the values of quality have been ignored. Credibility, again, integrity, and accountability, and those type of 4 values that we have put forward in the beginning of this talk have been ignored, and the quality in turn has not been only absent, but actually I presume dead. Absent quality gives present crisis. About the scale of the crisis, it could have been controlled by applying the measures and the quality management in its elements as well as its soul, which is the values. And by the end, ladies and gentlemen, I will conclude my talk modeled on the proverb, cat away, mice play. That's a very well-known one, I hope. What I say, what we can say today, quality away, crisis play. And final say of the whole thing is that we may not have control over the virus yet, but we do have control over our response to it in timely manner and measures. So thank you very much, ladies and gentlemen. I hope I did not take much of your time. I hope, Paul, that I'm on time. So thank you very much for listening. Thank you for patience. Thank you.
Thank you, Dr. Mansoor. Yeah, perfectly on time. I'm sure that the audience, in fact, I know the audience have enjoyed it very much. I've been getting some very positive comments, not just questions, but how much they've enjoyed listening to you and hearing about your take on the coronavirus and in relation to quality. On a personal level, it was enlightening, informative, and I particularly enjoyed listening to the piece about values being linked to quality. I don't think we hear that enough. And if you look at the B2B world or the B2C world, this is how transactions are done with values and quality, and it comes down to trust. And I think that is that links nicely with value and quality. We have a few questions for you. One of the questions is, as we've seen, not just in the UAE, but across the world, we've all been moved to an online learning environment, many of us with children, of course. And one of the questions was in relation to the skepticism of people moving to this. Do you think that this was in part due to traditional learning institutions resisting online learning methods over a period of time, the last few years?
Indeed, Paul, because ladies and gentlemen, I'm a little bit very enthusiastic when it comes to this particular online learning, because we have led an icon of online learning institution across the Arab world as Hamdan bin Mohammed Smart University. We have been, for the last 20 years in action and operation. We're the first online institution to be accredited by the Ministry of Higher Education in United Arab Emirates and the Arab world. So yes, indeed. The problem, Paul, is that our traditional institutions, either it is higher education or general education, they are so much obsessed with the legacy. The legacy has been formed over not just tens of years, but hundreds of years. So yeah. I think that particular passion actually is the reason for having so much passion toward the traditional mode of learning. And to get out of it is to get out of the comfort zone that has been established over hundreds of years. So that's why I always been saying to those people, and especially the people who are skepticism about the learning, because I always been said, when I was training Paul, a group of high school principals just back in 1999, 20 years ago in 2000, I was telling them the role of a school is about how much I will be able to grow the kids into the scientific way, into the growth of scientific growth of their mindset and of their brain, into the knowledge aspect, but definitely not to take care of something that the family should take care of. I think the parents today, in the last 40 years or 35 years, both parents were out there. I'm talking about this geography, the Arab world, were out there to the work, and their kids being left only to be taken care of the school. And today, the online learning brought the kids, they just get rid of them to go to the school, it becomes into their lab again, as they were a little bit younger. So I think the challenges were with the parents, not with the kids. But I think the kids today, my grandkids today, they're enjoying having their online learning and distance learning from home, because they are learning at their own pace. One of my grandkids, she's mashallah, she's one of the stars in her class, but she said, Grandpa, I'm very enjoying because I can do things much more quickly. But when I'm in a class, in a group, and one size fits all, I thought that I will be a little bit pulled back because of the rest have to catch up with me. But today, I am my own pace. So I think what is coming, Paul, is very promising. I was telling this 4 nice statements, if you allow me to say so. I was telling this to people in 2003. I was telling them, shopping is essential. However, shopping malls, not anymore, because people were buying things on the internet, online. Banking, Paul, is essential, but banks as brick and mortar, not anymore. That was back in 2003. Schooling is essential. Schools are not. Learning is essential. Universities are not.
Interesting. Yes, very interesting indeed.
Today, just now, there are kind of alliances going on between MIT and Google and Harvard University and Facebook, as well as Stanford. They are going to looking up to, why do we have to have those universities across the world? Why we don't have a big umbrella for learning for the whole population? Because Facebook has a population over 3 billion. So yeah, it's by itself a geography, a new geography has been established. So I think it's a matter of time, Paul, that people will get into it. People did not understand. I think as a matter of teasing my colleagues at Hamdan bin Muhammad Smart University, I said, I think we might do a coronavirus a statue at our campus, because I think that coronavirus stimulated the thinking for all educational institutions to go online.
Yeah, well, I think you started off by talking about opportunities out of crisis, and certainly from a work perspective, I think we've all been affected by the fact that we've had to upgrade our thinking in terms of using our smart systems. I'm a better laptop operator than I was, I think, 2 months ago, for sure. I have a direct question from one gentleman. He uses some terminologies which probably means something to you. He talks about K-12 and should we support research in the level of executives and principals as a tool amongst the leaders and not just the students?
Yeah, of course. I mean, the K-12 teachers, yes. I think there are lots of brilliant teachers today in the field around the globe that they are ready for those to be a part of this research. And I think today the collaboration between the K-12 education as well as the higher education post K-12, I think it will become very essential to have kind of a very close collaboration between the two in terms of the research. I think why not? It's an essential essential part of the work that we do online. Yes.
Okay. And where we talked about opportunities at the beginning, it's a crisis, and we know that crisis has emotion connected to it. But where do you see the sectors that will, I don't know if it's the right word, but will prosper out of this opportunity? We've already talked about smart learning and online systems, but do you think there are other industrial sectors that will come out of this stronger than they were before, as a wake-up call almost?
I think that there are different aspects to different sectors, Paul. What I can say in terms of education, of course, because I'm a part of this platform, I'm part of this particular sector. But other things are, I think, with like Einstein said, in the midst of any crisis, there's lots of opportunities. I think in the last 15 years, the hotel industry, it shook up a little bit once the Booking.com and Airbnb came into existence, and the transportation industry also been affected by having Uber when technology entered in this arena of transportation and road and transportation. So I think whatever is going to come right now is going to be hit. I think one of the major areas is about the tourism, is about the hotels. The tourism industry overall, they have to be shaken up, and a wake-up call to change the way that they conduct business. And also the education sector would be immensely will be transformed, I think, and especially that most of the post-corona virus and COVID-19 pandemic is going to be dealing with artificial intelligence. The AI and its presence is going to be considerably in most of the sectors, economical, tourism, even the healthcare itself. The healthcare actually is going to be reshaped once more. And the pharmaceutical companies as well, they're going to be shaken up. And so there are lots of changes and opportunities lie there. And people started actually, I know few individuals that they have a zero business. Today, they have more than 500,000 dirhams in their account in just only 2 months. So people are innovative. People are innovative and to be accommodating throughout this. And it depends on the environment, the ecosystem of the country has. So such as United Arab Emirates. I mean, United Arab Emirates is one of the examples, actually. I'm looking forward that the United Arab Emirates will become the country #1 in the world, which attracts all talents and all youth around the world to UAE. Being the safest country, the country that the leadership declares, you don't have to be concerned as an individual, as an expat, or as a local. We are going to take care of you. Your health, your food, your medicine, and your food is a red line. We cannot be living without those things. So I think the ecosystem which United Arab Emirates today provides its population, and it will be definitely voicing out to people to be able to attract those talents. So I would foresee that United Arab Emirates will attract very much big investors and big population into post-COVID-19 era.
Mm-hmm. Yep. I'm sure that there will be a lot of positive changes coming out of this. It's made people rethink, reshape the way they do things. I think one thing, of course, is the environment that's certainly benefited from the last 2 or 3 months. So that's one of the positive things. And we've got a couple more questions here, and then we'll end the session, because I know you've been with us for 1 hour. How long will the universities lock down the online education? Because it cannot totally replace traditional education, especially for applied sciences. Applied sciences is quite specialized.
Yes, I understand the applied sciences, ladies and gentlemen, but let me tell you this one. At Hamdan bin Mohammed Smart University in 2009, just 11 years ago, we conducted Innovation Arabia at that time, our annual conference, which is our logo is around you right now, and we are doing it with Index as well. During that conference in 2009, in a venue that it has a minimum requirement of the infrastructure of IT connectivity, we conducted a hard surpass procedure, the doctor was standing with us on the podium in Dubai, and the operation and the surgery being conducted in Greece, in Athens, in Greece, and it was online, and the whole audience was attending that particular procedure. And it was a bypass of heart, the most critical one. Yeah. So if the applied sciences could be done on a virtual environment like this in 2009, what we would say if this thing is going to happen in 2020. Not only this, but there are today virtual labs and virtual reality that a student can go into a virtual lab and do whatever he was doing as if he is in a real lab within the campus online. Not just only the chemistry, but also the surgery. So the technology advancement, ladies and gentlemen, be sure the technology advancement will take care of all of these type of things. And it's already taking care of these type of things. But it's only for us as academicians, for us as teachers, we always have that particular passion about the face-to-face component. It's I would call it obsession, passion for the past. I think if once we got out of that particular part, I think we'll be totally free to think about.
Okay, I'm just looking here. I have one more question. Do you expect the same economic performance in the world as well as the world medically joining hands to get out of the repercussions of COVID-19? Do you expect the same economic performance in the world as well as the world medically joining hands? So that's an interesting connection. Yeah.
Yes, indeed. I'm very optimistic guy, Paul, when it comes to these type of things. I think what has been experienced during the COVID-19, coronavirus era in the last few months, I think for the first time, after hearing all news around the world, everywhere, clashes, conflicts, everything, for the first time, the whole world in a solidarity against one enemy, which is coronavirus.
Yeah.
That tells a lot. This solidarity tells a lot. Even when we did the prayer for humanity just last Thursday, across the world, across all religions, whether they are Muslims or Christians or Jewish or Hindus or whatever religion across the world, they just made a solidarity to pray for the world and for humanity for having combated the coronavirus. So I think the economy, we are still analyzing things according to the past. We are not foreseeing things to the future because we are still, the research across what happened actually during the last 3 months is still fresh. Is still fresh in the oven. It has not been baked yet. So I think baking it yet, I foresee personally, I might be wrong, because most of the statistics that I read, most of the colleagues of ours in economy and all these things might have a different opinion. I do respect them, but my own, I think the economical shape of the whole world would change towards positive, to have a positive impact on total humanity. And I think this is very good, because previously people were talking about the rich and poor, talking about the north and south, talking about the wealth gap across the world. But today, in this particular pandemic, the post-pandemic era will be much more better, although the economic growth might be on a slower bend, but the dissemination and distribution of wealth across the world will be very foreseeable. For instance, I'm talking just to you, United Arab Emirates, as a part of its obligations towards the world, this is what our leadership believes in, and they have extended their hands across the globe. Asia, Europe, Africa, South America, United States, North America, everywhere. Yeah. It's not just because, yes, we have certain challenges inside UAE also, but yet did not stop our leadership to be able to extend hands. And I think as an exemplar, as United Arab Emirates, what it's doing actually currently, from my perspective, I think it's something noble, something exemplar, something that other countries also are doing at the same pace. So this will make me much more enthusiastic for the future and much more optimistic.
Yeah, I agree 100%, completely with you. And we've got one more question, which I'm going to give to you.
The third one more. Okay.
It's not a tricky one. I had a couple of tricky, but I thought, no, we won't do any tricky ones. Will online education, online working, online living affect social skills of students and people?
Yes.
Their interaction with people is becoming limited.
Yes.
So how do we manage that?
I'm going to answer you, Paul, in this question about my son, the youngest son, Rashid, in 2009. My son, one day I was going to lecture the principals of high schools about the future schools in 2009. In that morning, Paul, I sat down with my son as he was getting his breakfast, and I asked him, Rashid, if just, I would like just to feel how I would think if I'm in his shoes. So I asked him, Rashid, what do you think? What kind of a school that you will envision for the future? He said, Dad, I don't want to go to school. I said, oops, why? How are you going to learn, son? He said, get me a robot in my bedroom. I said, okay, I will follow your thread of thinking, no problem. I will get you the robot, but how on earth are you going to mingle with people? How are you going to be socializing? That's one of my questions as well. He answered me, Dad, you send me to the school today from 7 a.m. I come back at 4 p.m. Am I right? I said, yes. I said, how many people I'm mingling with, Dad, with the school right now? I said, okay, you are boys section. How many sections you have? He said 4. And he was in grade 9 at that time. And I said, okay, in each class, if you have 25 to 30 people, so you are talking about 120. He said, Dad, not only in my classmates, my peers, but also in other classes. So I said, okay, 200. He said, Dad, consider it 300. Now, Dad, you are paying money, sending me to school. You're claiming to socialize with people. When I get back at 4 o'clock, at 4:30, 5 o'clock, I'm mingling with 2,500 people over the net. So where do I stand? Am I socialized more here or where you pay me to go to school? I kept my mouth shut, Paul.
Very interesting.
That's how can I answer the people who are a little bit reluctant to accept the part of the touch things.
Yeah, things change, things evolve. And I, as you say, on a personal level, I've enjoyed seeing my children at home more than I normally do. It's a bit disruptive sometimes, but it's, I certainly don't miss the drive to school in the mornings. That's one of the benefits.
Yeah, of course. And Paul, the distance learning actually taught us that we might save 3 to 4 hours being on the road.
Yeah, for sure.
Distance education and online education taught us that you might have less pollution creating on the road transportation. And you might have also, a 0 car accidents on the road.
Yeah.
So if I'm going to contribute considerably to the environment, wouldn't it be advisable to go for online?
There you go. Well, I think that's a great place to conclude this evening's webinar, Doctor. It's been an absolute pleasure. We've had lots of compliments online how much people have enjoyed this evening's webinar. So all I can do now is say thank you so much. I hope we get to do it again soon. Lots of positive feedback, and thank you once again, and I wish you a wonderful evening. We wish all of our attendees and our participants, we had many, many, many of them. Thank you for attending. It's been an absolute pleasure and very enjoyable. Thank you, sir.
Thank you. Thank you to all. Thank you.